Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I am here with a very special guest, Annie Kim, an incredible nurse injector from Beverly Hills, one of our OR nurses, and also my patient. How are you doing?
Good. Good. I'm doing great.
Well, I'm glad that you came in. Mm-hmm. And it was a very specific reason why we wanted to get this podcast done, because Annie has a story to tell about plastic surgery that I think is very relevant. I think that what you've gone through and where you're going is really going to be helpful to a lot of people.
Yeah.
And that's why I wanted to do this today. So I thank you first for coming in to discuss this is a very obviously personal subject, mm-hmm. because you had a story about plastic surgery that started sad and now seems to be going better.
Right.
And that's where we are. So tell us a little bit about like who you are, like you're a nurse and what you do, and give us your background.
So my original background was in critical care for 8 years, and then I've been doing aesthetics for the past 3 years now and working in the OR. I work with you and Dr. Rogers and, two of the best like plastic surgeons in Beverly Hills. So,
both Pittsburgh graduates.
Both, yeah.
The University of Pittsburgh strikes again. I always have to bring that in. Sorry, I'm a Panther, and that's the way
Go
it is.
Penguins, right?
Yeah, absolutely. And you are also a hockey fan.
Yeah, I do like hockey. More so just watching. It's like Disney on ice, but like men on ice.
Okay, I never thought of
that. But no, I think I'm also Korean, and Korean beauty and everything is really popular right now, but culturally, like, this is what I grew up with. And along with that are just the Korean beauty standards and like the pressure to be perfect and whatnot. So just growing up, I was heavier. I wasn't like the pretty girl or anything. Never got asked to prom, but then the guys were asking me how to ask my friends to prom for that. You know what I mean? So, just not a lot of self-confidence. And then the first time I got my lips done, I just was like walking taller and I felt better. And that just kind of like, it kind of steamrolled or whatever, snowballed from there.
Plastic surgery instills confidence. People, like, a lot of people don't understand because they're like, oh, I would never do that or I wouldn't do anything. But
they would if they knew. If it was for free, if they're like, oh, we'll do all this for free or whatever, they'll be like, oh yeah, I'll do it. So it's not that.
You may be right.
Yeah, no, they would. But it's just like, I tried all the things and whatnot, in regards to my body, I've been on a diet since I can remember and whatnot. So I did have a lot of body dysmorphia and just issues with that. I do think I maybe went a little overboard at one point, but it's kind of like you have to learn for yourself to really understand,
like where the line is.
With what?
Where the line is.
Yeah, I look at old pictures like with filler. I was like, oh my God, I look crazy. Most of my filler in my face is dissolved. So anyways, in regards to like, my nose, I think with all of the Korean beauty standards, like it's just kind of drilled in your head that a more quote unquote like Western nose is what is considered beautiful. Like my grandma, I love my grandma, and everything, but she used to pinch my nose all the time and be like, oh, it needs to look like this and stuff. Since I'm a little kid, since I can remember. So, but then when I got my nose done for the first time, she's like, why'd you do that? You're so pretty. I'm just like, Grandma, you caused this trauma. Like, what do you mean? But
so when was that? How long ago?
What, the
when
first
you had
one?
Your rhinoplasty? Yeah.
The first one, it was about 2 to 3 years ago.
Okay.
Was the first one. And I just, for some reason, thought that because I'm Korean and I have a Korean face, I should see a Korean surgeon.
Right.
And that's what I sought out for.
And how were the results when you got that done? And that was, obviously 2 or 3 years ago. Mm-hmm. What was going on for you then?
So initially, there's the swelling and everything, and over the course of a year, it changes a lot. But then once the swelling went down, you can really see all of the irregularities, and, my nostrils basically looked like, I always look like a snake. I look like Voldemort. They just were like little slits, but then also my nose was turned up so much that, everyone is not symmetrical and not even, but my nostrils were like facing you.
Yeah.
Like they were just like looking at you
Right.
and stuff. So even though everyone has uneven nostrils, even if you don't have a nose job, mine was very noticeable. And then also around this time, like I'm doing more stuff with social media, I'm on camera more, and I'm looking at myself and I'm just like, what the heck? Like what is going on? I'm pretty good about not letting negative comments or anything, bother me on social media. But my nose became a really big insecurity of mine. So when people would say things about my nose, even if it was a video about like something totally different, like the topic of conversation was always my nose and how bad it looked. And but I agreed with them. So it's hard to not take it personally, I guess, even if it's some random person.
Yeah, I mean, Heather Dubrow and Terry always say, "Don't read the comments,"
Right?
But it's hard not to.
Well,
right?
part of it, I mean, it's part of the game of the algorithm. Like you have to respond to the comments, you have to do this and that. So, I mean, while I was trying to grow and growing on social media, like I had to respond,
of course,
to them. But it's a certain point where it's like, okay, well, how much of it is like, will I take versus like protecting my peace? Like I've archived and gotten rid of videos on my Instagram before that statistically, like the stats are like really good, but most of the comments, if not all of them, are not nice.
Ugh.
But it pushed the video out, but then more not nice comments came. So it's kind of like a battle of like what you're willing to take and
so you were
endure.
getting hammered on social media, it sounds like, and then you had another revision to the nose, right?
I had a revision. So I had the first one, and then about I think 2 years later or so, I had a revision, just a minor revision, and I mean, it got a little bit better. Like my nostrils weren't like little slits. Like they were a little bit rounder, but my nose was still flipped up. Like it wasn't the revision that I needed, I guess. And then I started working for you, and you're like, yeah, that's not a good.
But you had two. Didn't you have two rib grafts with those?
So my rib and my ear, which my ear I didn't even know was.
We'll get to the ear.
Yeah.
The ear needs some help. We'll get there. But you had the rib graft. So just one rib graft, right?
I believe so. Well, I had the rib graft, and then I remember they did something like I had staples on like the side of my head.
You had a fascia graft
and then I also had some taken out of my ear from the first one too. And then every person that I showed the scar to was like, "Why is it so low?" And I'm like, "I don't know. Like I'm not the surgeon, but it's a huge. I mean, it's like." I don't know, 5-6 inches long or so.
It's big.
And
the ones I do are basically under an inch.
Yeah, and usually I can cover the scars up with my tattoos and whatever, but it's just like it was indented, like the scar, it wasn't healing well, and just again another insecurity. Like if I was wearing a bathing suit or whatever, like it was in that little spot, like when you sit down, like where you have like a crease. And it was indented, so it made it an even bigger crease, and it had a bigger roll. And then on top of my own body dysmorphia issues, whatever.
So simultaneously, we were also looking at the breast augmentation that you had, which was 5 years ago or so.
So all of my plastic surgery that I had was within like a 2 to 3 year like time span, like all within like 2 years. My boobs, I just kind of was like, I wasn't in a good place mentally. I was going through a divorce at the time, and, just doing all of this plastic surgery, like it was making me feel better, but I wasn't doing the research. So, I'm like, were they actually plastic surgeons? I have no idea. I don't know. I'm like too scared to look. But the boobs I did saline. Basically, he just kind of popped them in. And then when you and I were talking and I showed you like the before, you were like, no, like you always needed a lift.
Yeah, you did. Out of the gates, you needed to have a mastopexy, a lift, and it wasn't done. So you just had implants that were put in under the muscle, and the breast tissue was literally like hanging off of the implant, which is kind of like a waterfall deformity.
Yeah, and I had from my clavicle down, and it was only the right side. Like there was no flat. I had no like décolleté. It was just clavicle and boob. Yeah. Like it just was like that. And so it just made it look a little bit like inappropriate. like it just was like one really big boob. So I had a capsule, you said,
Yeah,
right,
it was
on this
capsular
side.
contracture on that
So
side.
it was causing me pain. Like it was, over progressing, and over the past, like, a couple months or so, it was just like hurting more and more. Size wise, you can tell that they were different.
Yeah, they were very asymmetric.
They were two different They were two different boobs.
Totally.
And then when we took them out, then I know that you don't think you were like, oh, that happens, but the little floaties in there, that was I'm so disgusted by that.
You are.
And I can't get over it. I have my implants, like I saved them.
Yeah, we kept them for you. We took them out. I wanted you to see what we took out.
And like one of them was literally the one with all it was like yellow. They're saline, so it should be clear. It's yellow.
Yeah.
And there was floaties. I don't know what it is, but and it was just slowly like leaking. And remember, like the implant, it was like indented, so it was like slowly leaking. And it's just like, what if I got sick? Like I have no idea. But I just wish I wasn't working in aesthetics or plastic surgery at the time.
Right.
All I knew was critical care, which, is very different than the OR. I mean, I kind of knew how it worked, like the medications and whatever, but we get the patients once they leave the OR. I didn't know that there's like the anesthesiologist and like the setup and whatever. Because one of my surgeries, which was done by, I don't know if I told you this, my first BBL was done by an orthopedic surgeon. Awake.
Oh no.
Awake. It was awake. It was awake. I remember
There's
a lot of it.
nothing orthopedic about a BBL.
No, I remember a lot of it. I knew the medication, so I'm just like, locked in my body. I can see my vital signs. I'm seeing the medications, and I'm like, I can't say anything because I'm so high on the
probably give you ketamine.
Yeah, I was on ketamine. And I even remember him saying things like, "You're not going to remember this." I'm like, "No, I remember."
And you remember it all.
Yeah, and it was just very, very traumatizing.
Well, I think everyone listening to this podcast should remember that typically an orthopedic surgeon doesn't do liposuction and injection of fat into the buttocks, which is what a BBL is, a Brazilian butt lift. So, yeah, I don't know how obviously now that wouldn't happen for you, but by the way, it's happening to somebody today. And that's the importance of this podcast and why we're having this conversation. Because when you get plastic surgery, who's doing it and their experience and what they're able to take care of afterwards, because it's the complications of plastic surgery. I always tell people that you'll find out how good your plastic surgeon is when things aren't right. And that's the truth, because plastic surgery has problems. I have problems with plastic surgery all the time. We all do.
Anything in medicine, like that's why you have the paperwork. Like there's always potential for complications.
And your surgeon will either rise to the occasion and take care of you and make things better and know what to do, or you can get, the silent treatment and the abandonment. I have a guy today who flew here from Africa who showed up today, who was treated by a surgeon that I know very well, and he can't breathe. His nose is collapsed. And the surgeon just basically said, I'm done. Like, you need to figure out something else. So, this guy's on a plane from Africa, to come here to get his nose fixed. And he was operated on a guy that I sat on panels and podiums with to lecture. Yeah. So, like, you don't know what people are going to do once there's a problem. And that's why, the reputation of the practice is really crucial.
And also, like, I'm a nurse, and I didn't know. I just assumed, maybe it's me being naive, I just assumed if someone is offering plastic surgery that they're a plastic surgeon. Like my ex-husband's a neurosurgeon. Like I know how residency works. Like there's like, if you're a neurosurgeon, like you go through a whole neurosurgery residency where it's strictly doing that. Same with plastic surgery. Like, and it really is like an art. Like if your plastic surgeon can't draw a circle, like how am I going to have him like work on my face? You know what I'm saying? So, but I think just like the reason why I'm so transparent about my surgeries and whatnot is because I just don't want the same thing to happen to somebody else. And I'm in such a fortunate position where I work with, like in Beverly Hills, like with you and with Dr. Rogers, and like where I have the resources and everything to get these things fixed. Not a lot of people have that. Like they get, they spend all of their money on this one surgery and that's like all they have. And then if I had to live with that nose, like I don't know what I would do. Like it literally changed my, oh no, hold on, I'm going to start crying. Wait, I can't say it. It changed my life. Like, and,
well, let's talk about that. So we did an exam, I finally said, okay, well, you want to be a patient, like, let's do a consultation. And we went through the whole process. You fill out all the paperwork. You come in, you even though you're a nurse, and I've learned with medical personnel, nurses, doctors, that
They're the
it's
worst
even
patients.
more important. You said
Nurses
it.
are the worst patients, or people in medicine are the worst patients.
I don't know. I think doctors are pretty bad too, but nurses are definitely tough. I don't find nurses to be the worst. I find lawyers to be some of the best patients because they show up on time, et cetera, and they're very good about the research.
I was on
and follow
time. I
directions.
think I
You were
was on
great.
time.
You've been a great patient. And so,
cool.
So we did the whole thing by the book, and I gave you what I thought I could do for you. I thought we could do, fix the nose and the breast simultaneously with the concept that, well, if I'm in the breast pocket, I can harvest your rib and then use the rib graft to fix your nose without making another scar. We'll get to how that plan got foiled later on. But that was our plan, and I said,
Right.
I think it makes sense. It's a big surgery.
Yeah, and in regards to recovery, like I feel like another thing people say to me or on social media is like, oh, you're doing all this stuff like plastic surgery. I'm like, I'm doing it because I had the first round of my surgeries were all botched. I'm like trying to fix it now. Like the recovery is not fun.
No.
It's not like a fun process to go through. And then let alone the emotional response from like the anesthesia and then just like having to trust the process from the healing. Like I was doing this because I had to do it, not because I wanted to do it. Like I had to fix what was wrong. It was like causing me pain, like, and everything.
The nose was in a bad place. It was very short. The nostrils were sort of slits.
I look like Voldemort.
I didn't say that.
But I did.
So we'll have some photos. You guys can see them. But the reality was I knew that I have the experience with short noses like that, many, and really the place that I gathered a lot of that experience was in fixing cleft noses, and where one side is much shorter than the other, and using the ear cartilage composite grafts which you needed to lengthen the lining of the nose and all that. And so I said, let's do the breasts and the nose together. And it was a big day. I think we were in there for 8 hours or so.
Longer than it was planned.
Yeah,
I remember
it was
that.
really difficult. I worked my butt off on your nose. I worked my butt off on your breasts. Your breasts were a mess too.
Yeah, and that's what I'm saying. Like it was hurting. It was causing me pain. The nose was causing me like emotional pain. And it's like I would say no to photo shoots, like to different things, because I was like, I can't have the topic of conversation like be my nose. It's the center of my face. It stopped me from doing a lot.
So we went to surgery, and you are now how far out from surgery?
I think
3 weeks.
3 weeks.
Tomorrow, right?
A Thursday. Today's what day? Wednesday?
It's Wednesday, yeah.
It's Wednesday. So yeah, tomorrow is 3 weeks.
So this is 3 weeks after surgery.
Yeah.
And you were in Toronto with some big, TV event thing that you were doing, and you kept posting these photos. I was like, I can't believe how good she looks. 3 weeks after surgery. And what was very obvious to me and why I wanted to get you on the podcast and do this now, because I think, first of all, people should see what 3 weeks after surgery can look like. I think that's really important. You are still very swollen. You don't have the definition. We still have work to do on the nostrils, but it's a good indicator of you can get this done and still go about your life.
Right. Yeah.
And do TV, like you did a TV shoot in Toronto.
It was. I mean, everything was filmed. Even rewatching some of the footage, like. My nose wasn't the topic of conversation. Like it.
That's right.
I mean, not in like a bad way. It wasn't the topic of conversation in a bad way. Like I looked just normal.
That's right. You operate on your nose so you don't see it. That's the whole point. You don't want it to be a topic of conversation.
Right.
You want it to just be like, here is
It's just me. Like, here
Annie
it is.
Kim.
Yeah.
Right. Here she is in front of you. She looks amazing. And like they don't say, oh, and look at her nose. Like nobody talks about your nose. I have people that will say to me, oh, I'm getting this about my nose. I was like, well, then something's wrong with your nose. Like nobody should ever look at your nose and comment on it. That's, that's unusual to get comments about your nose, which means that something is drawing their attention to it. So when people tell me that, I take it very seriously. And then that's when I start to say, what is it about their nose that's making that happen? Yours was obvious. It was too short.
I mean,
it was over-rotated.
have you read my comments on the video?
I don't read the comments. So.
At least, if not all of them, it's like I can be, making a video about like how my dog died or something, and everyone is like, "What's wrong with your nose?" Like, "Oh my gosh!" Like, da 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 da. And I'm like, "I was talking about my dead dog." Like, what do you mean? So it's just, I knew that if I wanted to be kind of taken more seriously, and especially because I am growing and on camera more. And if there's like a message that I want to relay, it's never going to be heard because everyone's too busy talking about how messed up my nose is.
Got it. Well,
So-
they're not going to say that now.
No. You know what was the like craziest, like the weirdest feeling was when I posted that first picture. That was like my first post-surgical event reveal, photo since I had surgery. And I was only like, a little over 2 weeks out.
Yeah.
That was this past
I know.
weekend. It was so crazy reading the comments and the difference between, oh no, hold on, I'm gonna cry again. I need to soak it in.
You have tissues.
I know.
We brought them.
Hold on. It was just really nice to like not have people talk about my nose. But I wrote in the caption, like, I'm like, I'm very transparent. I'm like 2.5 weeks post-op, da da da. And the amount of people that were just saying I look beautiful, like overall, and then people who read the captions are like, oh my God, your nose looks amazing, da da da, whatever. It was just a very different, I was like, I'm not used to that. Because I'm used to,
I know. It's tough.
like, Voldemort, like I look like a snake. So it was just, it was really nice to not have to, oh no, it's coming down. Not have to read those
You can get the
mean
tissues.
or not hearing those or seeing those negative comments. It was really just kind of like refreshing.
Well, you look great, so that's the good news. And you can definitely grab some tissues.
Yeah.
See, we brought the box of tissues. That's like when I go to the urologist and the guy throws the tissues on the exam table, and I go, "What's that for?" He goes, "That's for your tears." So anyway, you got to get your prostate checked. That's how it goes. You got to. I got prostate cancer all over the family, so that's what I do. But I'm not making light of your beautiful face. You do look great.
Well,
and
you can't make me laugh too hard.
oh, because it still hurts.
a little, yeah.
So I saw those. I saw the posts, and I was just like, that is a massive change from where you were. And that's why I thought when we talked about doing this, I was like, I think I can really help you with it. But I really thought that it would take a lot longer for the, sort of that confidence build to come. But it's obvious that it's coming for you. You feel more comfortable. I'm sure your breasts feel better. What did we put in? 6.
Yeah. I was like, I saw the pictures. I was like, oh, they really
it's only the surprise in your voice that hurts. But they look amazing.
Yeah.
And that's what they should. We did a full lift, full anchor scar, mastopexy, which is, and Dr. Rovelo and I talk about this all the time with mastopexies. You kind of have to do the right operation to get the right results. The scars become sort of invisible, even though they're there. When the breast shape is beautiful, nobody cares. It's like, look at the shape. They look incredible. The nipple areolar complex is in the right position. The breast mound is in the right place. They're right on your chest in the right spot. And they'll settle. Again, it's only 3 weeks.
I don't want them to settle. I want them to stay how they are.
No settling,
I don't want
please.
them to settle. But we did the lift, so they shouldn't there's
they're up
obviously still swollen, but it shouldn't change too much.
No,
we did okay, good. Because I remember I told you, I was like, I want them up to my chin. Like, I want them pretty high up.
I want to rest my head on them.
Yeah. No, but I have like a décolleté now. And I have that kind of separation between like my chest and my boobs. And it just, I don't know. I can stare at myself naked all day, and I'm just like, oh my God, that looks so good. And
3 weeks after surgery. Good for you.
But you know what the weirdest thing was is maybe it was because I did my nose, and the nose was the one that was a little bit more painful and harder post-op. My boobs didn't hurt at all. I remember I told you, I was like, is something wrong? Because like I really am fine.
Well, and the other thing that I want to add is that I went in to go get your rib, and it just wasn't enough rib cartilage. I actually had to make another incision to go get the eighth rib.
But it's so tiny compared to the other one.
I know, but I was really disappointed because I was like, there's the whole reason to do this was so that we saved you that other scar, but had to do it. I needed the cartilage, so maybe there's a spot to get some ink there or something for you.
Again, I'm very fortunate where I have access to every laser, so again, like I'm very fortunate to have all those things. Not everybody is. if I wasn't working in this industry, like I couldn't afford this stuff. Even like the, Botox, like, I wouldn't be able to afford it and like maintain it. So that's why I am so transparent, because I don't want this to happen to somebody else.
Well, and you did pay for your surgery.
I did.
Granted,
no,
you
I
got
did. I got a little discount because,
you're in the industry.
I'm in the industry and, you're my boss and whatever. But I mean, it's still a lot of money, but like, I mean, everyone's perception or whatever of a lot of money is totally different.
Yeah, in Beverly Hills, if they knew what you paid for this operation in Dallas, Texas, even Beverly Hills is so expensive. It's so astronomical. They'd be like, girl, where did you get that money for that? But that's kind of what we're used to out here. That's kind of the way that it is. And, the nurses get paid a lot more money here, and the anesthesia costs more money, and the ORs cost more money.
Everything's just more expensive.
It's like California's crazy is what it is. But there are also some very talented surgeons here who can help with these big problems. And your problem to me was like a cleft nose issue, and the lining was short, which is the inside, there's skin on the outside, and there's, mucosa, which is the skin of the inside of the nose. And your biggest problem was the skin on the inside of the nose had to be lengthened. And that's where we used the ear cartilage. And then we used extension grafts onto the dorsum, the bridge of your nose, to push the tip down. And I think it's doing great. I mean, it is 3 weeks. It's going to get better and better. And like I told you, with revision rhinoplasty, it's a project. We have a whole year that we're going to be working at this. It is not it's not an overnight deal. But I love the way that it's looking. I was so kind of moved by your confidence in these photo shoots from Toronto that I was just like, I got to have her on to talk about it now. Because I think people think like, I'm going to get this revision rhinoplasty and not go out into the world for, for 6 months.
Right, yeah.
And that's just not the case.
No,
it can be done differently.
I was filmed the entire time I was there.
Yeah.
And I thought it looked good. Like, I thought it looked
well,
great.
What's your Instagram? You want to get some followers, this might be the time to do that. People can go judge for themselves. Yeah. So,
wait, what did you want me to say?
Tell them where your Instagram is.
Annie Kimchi. Like kimchi, like...
Annie Kimchi.
It's like, it's punny, right?
It is very punny.
Because I'm Korean and kimchi's Korean.
I think it's very good. Yeah. I love the handle's great. But they should go look at your Instagram. You can see the difference. I mean... I don't, sit here. I didn't have you on to do like an attaboy for myself. I did it because I want patients to know that you can do this and still live your life and do things and have this kind of, the technology in revision rhinoplasty is different. It's changed.
Yeah.
I sewed down the skin envelope. We put in structure. Like I told you that you would be able to do this. And if you read everything, and even if you listen to my old podcasts about revision rhinoplasty, it's like, oh, this is going to be a disaster. You're going to have to take... it's going to 2 years before you get some no. Revision rhinoplasty is different today because of the way that it's done. The techniques are better. And you can do this and still do a photo shoot 3 weeks after. I had a patient that came in and said like, oh, I'm not doing anything till January and then she's like, hey, I just booked a movie. And, she was a week after surgery and she booked a movie post-op. And she's like, it's in 4 weeks. What do you think? I was like, you're going to be fine. This is what we're going to do. You're going to go to do hyperbaric. I'm going to, get you on all the anti-swelling things we're going to do. If we have to do some oral steroids, we will. There's tech and there's approaches that you can get this done and still go do your life.
And like the lymphatic, massages. Like make sure you go to like a good person, obviously, because we don't want to like mess up the nose. But
please don't mess up the nose.
No. But that's the other thing is like, there is patient homework that has to be done if you want to heal quickly and in the best way.
Yes.
So I did hyperbaric, I did cryotherapy, lymphatic massages, like all those things. And everyone's like, how'd you heal so fast? I'm like, well, I did my homework.
I focused.
Yeah.
You were a good patient. You did things that are going to enhance the healing.
Right.
Don't drink alcohol. Alcohol is a big problem post-op.
Yeah, I don't even really I can't drink.
Yeah.
I think I'm allergic.
Yeah, probably the aldehyde dehydrogenase. It's a deficiency of that enzyme.
Yeah.
Do you turn beet red when you...
Turn beet red? Because isn't it like Asian people and then also women? And it's both of those things?
Yeah, it's various Asian cultures that that you can, in peoples, that you can find the aldehyde dehydrogenase deficiency. They drink it and it just gets...
Yeah.
You get beet red. It doesn't. It's not enjoyable. So that's
I get
good.
sick. So I didn't drink. I tried to be mobile to just like.
And you ate healthy. I know that. No, not really.
I like Taco Bell sometimes.
Taco Bell.
I have a video actually where I was eating a Crunchwrap.
I think there's some chemicals in there that are helpful for the healing. I'm pretty sure of that.
I ate a Crunchwrap and it kind of hurt my nose because I was like, I had to take a big bite. But I mean, I tried to eat healthier. Like it was more like a lot of protein shakes and like stuff like that. So healthier. But I did treat myself to some Taco Bell.
Well, there you go. Well, you're doing great, and I really appreciate you coming on to talk about your surgery. I don't want to keep you all night. I know you actually have another event
to go to.
So I appreciate you stopping in to do this. Do you have any other advice, anything you want to kind of tell our listeners that they should know about the process of, doing these types of revision operations?
I think that the first question you should ask the surgeon is, are you a board certified plastic surgeon? And I feel like that's a yes or no answer. It's not a, oh, well, I did it. No, it's like, no, it's a yes or no answer. Because I just, being in the medical field, like I don't honestly, like I think it's really messed up that there are people who are not qualified to do this, who think they can, and essentially ruin their lives. The patient's lives because of XYZ. Do your research, and a lot of the messages that I get are from people who are, wanting to get things done, but they're scared to like tell their family or whatever and stuff. But it's like, you're the one that's looking in the mirror at yourself every day. You're the one that's, getting, and whatever. So it's like, obviously there needs to be an endpoint, and you don't want to look crazy, but I did all this stuff for myself. It wasn't for anybody. I kind of had to reverse learn and gain my self-confidence back. And yeah, I don't know. I feel great.
Well, that's great.
Yeah.
Any other comments, anything else that you want to add?
I got you a gift. It's like a little present. It's like nothing crazy.
Oh,
but
okay.
Okay.
Well, that's like very nice.
It's not like giving me a new nose and new boobs crazy gift. It's like it's small. So hold on.
Well, I'm excited to see.
I didn't wrap it. I'm sorry.
It looks wrapped to me. In my world, that's wrapped. Thank you.
Yeah.
Oh, no way. It's a Toronto magnet. There you go.
Where I've had my debut.
Perfect. I love it.
Yeah.
I know you're big on the magnets for the
I love
locations.
magnets.
Well, thank you.
But I just that's where I had like my reveal.
It's awesome.
And I don't know, just something small. I forgot to take the price tag off it.
Oh, that's okay.
Don't look at that,
I'm not. I'm sure it was too expensive as it
yeah.
is. But that's great. Now I can think of this and think about
how you changed
in
my
what
life.
century the Toronto Maple Leafs might ever make the Stanley Cup final, because it seems to not be happening. But no, this will make me think of you, and I appreciate it. That's a very nice gift, and I'm sure you enjoyed Toronto very much. It's a great city.
Yeah.
Yeah, but it was a big weekend too for the big reveal. So
no, it was good. It was a good trip, and a lot of definitely felt the confidence. And you can see it on camera too.
100%. Everybody kept saying it. You have no idea how many texts I got about how like, oh my God, Annie looks amazing. Like, how did you do that? What is that? I was like, it's the operation that
I got dressed for that event. Like I was, gifted these dresses from a designer that's never happened before. And, it's a very well-known brand. And he reposted me and I was like, oh my God. And I really don't think that would have happened unless my nose was fixed, because again, center of my face, like it just really changed. Whenever I say it, I always start crying. It really did change my life.
Well, everybody's got to go look at your IG. Annie Kimchi, which is on Instagram. I will tell you that you did exactly what I was hoping would happen one day, which is you said, my dress was by Guess and my makeup was by so-and-so and plastic surgery by J. Calvert, MD.
Yeah.
I was like, yes!
Just being
there it is.
Yeah.
Now, I want all my other celebs to do the same thing. It's not a big deal. It's not a big ask, but they won't do it.
Yeah. I mean, everybody, it's their own health. It's still like their own health.
No, of course. It's a personal thing. It's a personal decision. And, the fact that you're willing to share it, I really appreciate it because it will help other patients. Again, I think it's just a brave thing to do, especially, what you went through. And obviously we're not done. There's a long way to go to get this healed. So we'll stay tuned and keep watching how you do. Yeah. Well, why don't we heal this first and then we'll talk about that, okay?
I know that's a little, we're getting too crazy now. No, everything looks great.
And on that note, this is definitely the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.
Yay.